Hello guys, welcome back to my YouTube channel. Today we are going to discuss about elbow joint. Elbow joint is a synovial hinge joint. You can see a picture of elbow joint. This is the anterior view of the elbow joint and this is the posterior view of the elbow joint. There are three joints involved in formation of elbow joint. First one is humero-ulnar joint. Humero-ulnar joint. The articulation is between trochlea of the humerus and trochlear notch of the ulna. It is a synovial hinge joint. Then the other joint type is humeroradial joint. The articulation is between capitulum of the humerus and proximal concave surface of the radial head. It is a synovial ball and socket type joint. Then the third joint type is proximal radio-ulnar joint. Here this one proximal radio-ulnar joint. It is a synovial pivot joint. The articulation is between head of the radius and the radial notch of ulna. This is the radial notch in the ulna. You can see this is the coronoid process in the humerus and this is the radial process fossa in the humerus. This is the coronoid fossa in the humerus and this is the radial fossa in the humerus. Those two fossae are in the anterior lower end of the humerus and this is the olecranon fossa of the humerus. It is in the posterior lower end of the humerus. In this picture, you can see the elbow joint with the capsule. The capsule is anteriorly and posteriorly thin, but medially and laterally it is thickened. You can see medially there is ulnar collateral ligament and laterally there is radial collateral ligament. And also another ligament called annular ligament which thicken the capsule. Here this is the medial epicondyle and this is the lateral epicondyle. Those are non-articular. Medial epicondyle and lateral epicondyle are non-articular and also they are extracapsular. That means outside the capsule. Anteriorly, this capsule is attached to coronoid fossa and radial fossa. I showed you previous picture what is coronoid fossa and what is radial fossa. So you can see this capsule is attached to coronoid fossa and radial fossa anteriorly. It is attached posteriorly to the olecranon fossa. This is a picture after removing the capsule. You can see this is the synovial membrane of the elbow joint. This is the synovial membrane of the elbow joint. As in every joint, this synovial membrane also lines inner surface of the fibrous capsule. And also it is attached to epiphyseal lines of the articular surfaces of the bones. There are several fat pads. Here there are several fat pads in this elbow joint. Those fatty pads prevent the friction among articular surfaces of those two bones. Prevent the friction. This is another view of elbow joint. Lateral and medial views. This is the medial view, this is the lateral view of the elbow joint and this is the sagittal section through the elbow joint. These are fatty pads and synovial cavity, synovial membrane, outer joint capsule, then articular surfaces, articular hyaline cartilage. This is olecranon fossa. This is olecranon process, this is olecranon fossa, this is coronoid fossa. In this picture, you can see blood supply around the elbow joint. Though it seems to be a little bit complex, there are only several branches that we have to remember. There is anastomosis around the elbow joint as we discussed the anastomosis around the scapula. There is anastomosis around the elbow joint as well. I'll also explain a little bit about this anastomosis around the elbow joint. This is the brachial artery. It divides into radial artery and ulnar artery at the elbow joint at the level of neck of the radius. Brachial artery gives superior ulnar collateral artery, inferior ulnar collateral artery, profunda brachii artery. Branches of those three arteries anastomose with the branches which are coming from the radial artery and ulnar artery, as this. When we talk about the nerves applied to the elbow joint, as ulnar nerve, medial nerve, radial nerve, musculocutaneous nerves pass the elbow joint, they also supplies the elbow joint. Then movements of the elbow joint. There are flexor muscles, extensor muscles, pronators and supinators of the elbow joint. Flexors are biceps brachii, brachialis, brachioradialis. Extensors are triceps brachii and coneus. Pronators are pronator teres, pronator quadratus, and supinators are biceps and supinator muscle. We will discuss about the clinical correlation of the elbow joint. You can see in this picture, medial epicondyle or common flexor origin has been inflamed. It is called as golf elbow. When medial epicondyle or common flexor origin is inflamed, we call it as golf elbow. When the lateral epicondyle or common extensor origin is inflamed, we call it as tennis elbow. As you can see in this picture, this is tennis elbow. Then the other clinical correlation is pulled elbow. Usually this annular ligament, which is around the radial head of the is a funnel shape in adults. Usually it is funnel shaped in adults, but in children the sides are vertical. The sides of the annular ligaments are vertical. Therefore, a sudden jerk on the arm of a child which is under about 8 years, may subluxate the radial head through this annular ligament. This is called as pulled elbow. Called as pulled elbow. So that's all about the elbow joint. Thank you for watching.